Hi, I'm Alex Mitchell and I'm the creator of Cancer Stories. Cancer Stories is a video diary program which is designed to help people like yourself manage their cancer. And the key aim is to record previous patients' experiences, really a wide variety of cancers. And these are patients who are genuine, real patients from Leicestershire who've given their consent to allow us to record their story onto DVD or the internet. What we ask those patients is really to give a brief account over 30 or 60 minutes. How did they manage with their diagnosis? And hopefully by watching their account you'll be able to pick out some common themes from one or more of those videos. And those common themes might be things like what resources are available locally or nationally, or how do families cope, or how do people themselves manage with those awkward stages, either the initial diagnosis or the complications of treatment, or perhaps psychological and emotional complications which are sometimes overlooked. So overall, we hope that by watching the video diary program you'll be able to take some positives from other people's accounts, and hopefully that will help you better cope with your situation, whatever that is at the current time. Thanks for watching.
Hi, my name's Thomas. I'm 30 years old. I was born in Leicester and lived in Leicester in the council for most of my life. I was raised by my mum and my two sisters, older sisters. My first experience with cancer was when I was 19. My mum was in her 40s and she got diagnosed with breast cancer. It was a very hard time for all of us during that time, during especially the chemotherapy and the radiotherapy. My experiences, after finishing my GCSEs, I went on to do graphic design HND and photography HND. When I finished them, I started work at a printers in Leicester. After the recession hit, we got made redundant, the company had to sell. So I started work at a new company, much more hours. So I started getting a lot of pain in my leg. After a few visits to doctors and a few diagnoses of shin splints and some other growing pains and issues, I kept going back and complaining. I ended up being sent for an X-ray. The X-ray shown nothing but besides an enlargement on the bone from when I got hit by a car a few years back. Because of that, they sent me for an MRI. After an MRI picked up an abnormality, I had to go on and have a bone scan. The bone scan obviously showed something up, so I then went and had a bone biopsy. That's when I got diagnosed with osteosarcoma in May 2011.
Tom Hill has come in today to talk about his diagnosis, and I know from speaking to you in advance, Tom, that you've had a osteosarcoma, which is usually a bone cancer, although it can involve muscle too as well. I heard your biography there. It was diagnosed about May 2011, and it sounded like there was a little bit of difficulty finding the correct diagnosis initially when you were trying to get the answer to what was causing that swelling. Is that right?
That's correct. I had multiple visits to the GPs. I had 3 or 4 visits and a few diagnoses, a lot of painkillers, different painkillers, and of course I knew myself that something wasn't quite right. The pain was too much to be something like shin splints, and it was bizarre how it wasn't in both legs. It was just in one leg and in a local region.
How long had it gone on for when you finally kind of got the diagnosis? How long had you had that
Since
problem?
November on 2010.
Yes.
So from December over the Christmas period in 2010, it was very bad. A lot of pain.
Yeah.
The start of January was when the swelling started to show. It was more than just pain.
I'm going to just skip ahead a bit, but given everything you went through with the treatment and how things are now, what's your health like now compared to that time when things were building up but you didn't have a diagnosis?
I'm still not as physically as strong as I was. I still can't lift. My job's quite a heavy going job. I still struggle to do a lot of the tasks that I used to do. My energy levels are still they're quite good. They are good, but not quite as much as they were.
So prior to the diagnosis and prior to the symptoms, starting, was your health quite good?
My health was fantastic.
Yeah. And I'm guessing you were quite an active person.
I've always been with the 2 young children. I've got 2 young boys. Always keep you on your toes.
Yeah.
So I've always been very active. I used to do fitting as well at my job, posters and whatnot, and shop signs. So I've always been very physical and very motivated young man, really. So once this diagnosis, before the diagnosis, during this pain, obviously it was very restrictive.
Yeah, because that's a big issue, isn't it? It's not just the idea of cancer; it's actually how it's affecting you day to day.
Yeah, it's definitely. It was the pain. I've never felt a pain like that before. It wasn't normal.
No. So I'm really interested in how you got back to where you are now. What were the steps involved? I think you've been through quite a lot, but let's talk about that a little bit.
Okay, so after I had the endoprosthesis put in, which was in August in 2011.
So that was the first surgery you had?
That was the first and one of the only surgery I've had was the endoprosthesis. After spending a week in hospital, the nurses there got me to walk again, obviously in a solid cast and just with a Zimmer frame to get me to walk. Skipping forward, I had 3 months of chemotherapy. After that was when I could really start my physiotherapy because I was too weak during chemotherapy. When I started my physio, the pain was very hard. I didn't have any energy either really to do much more than half an hour at a time over a whole day. But gradually, very, very slowly, day by day, you build your energy levels build up, your body gets stronger again. And that's all it was really. That's all I've done is you just concentrate on my physio, just eating well, put your weight back on. So I was at a seriously low weight as well. So
you've been through a kind of step-by-step rehabilitation program to get back to where you are now.
Definitely, yeah. You have to take it step by step. I mean, at the beginning, you feel like you're not going to get back to the person that you were.
Absolutely.
But, I mean, it's took a year, but I think I'm nearly back to where I was.
I mean, I'm sure that in itself will give people motivation if they're in that early stage now and they see somebody like yourself who has come through. You've pushed yourself with help.
I had to have a lot of help, so much help. My mother and my partner are like rocks. They were amazing. They were there all the time. You definitely need someone there during physiotherapy. My first few steps that I tried to take, I kept falling over. I couldn't walk. You just feel like you're not going to be able to walk again, and the end just seems miles away. To be able to walk or even go back work, it just seems miles away.
Yeah.
But you've just got to take it day by day. That's the important thing. That's what I learned. You have to go day by day.
Yeah.
It's took me, like I say, it's took me a year.
Yeah.
But I'm back. I've been back work 6-7 months now.
Well, that's good.
Yeah.
And you were obviously somebody who was aiming to get back to work.
I had to get back to normality.
Yeah.
I really wanted to get back to normal, to get back to being me. Obviously, the cancer took everything away. You can't do any of your hobbies that you used to be able to do. You can't concentrate. I was too ill. So my main task was to get back to being me and being dad again to the boys and being a partner that can contribute to something to the house again.
So you gradually got back into those roles. I'm sure they didn't all come back at once though.
No, definitely not.
Was the work side of things, because you're a photographer, aren't you?
Yeah.
For a print company.
Yeah.
Was that kind of one of the last things to come back?
Definitely one of the last things to come back. The first and foremost thing was to spend a lot more time with my boys and my family, with my partner. Even though I've been in the house the whole time, you're just so retracted away from it all. I couldn't spend any time with them really. I was too poorly. I was always in bed or in the hospital. So the first thing first was to reconnect as a family unit. That's what I found.
Did you have to have
important.
A lot of time away from them when you were having your acute treatment and the surgery?
A lot. I spent three weeks back to back in the hospital, Monday to Thursday. So at home, I was only at home from the Friday to the Sunday.
Because that was
just 3 weeks of the month.
That's an issue in itself, isn't it? About people who have to come to the hospital a lot, whether that's a big collection of treatment right there and then, or whether it's coming back for chemotherapy or radiotherapy. It all adds up, doesn't it? And what that means is it can be a major disruption, and it's hard to carry on as normal in that time.
Yeah.
Did you find that you could bring the family in during that period, or not?
I could only bring them in when I was in a side room, when I had a private room. I didn't really want my boys around that situation really. They were too young. I didn't want them to ask too many questions because I didn't want them to find out what I had. We didn't tell them I had cancer.
Okay, because that's another question I was going to ask, whether you felt that you should wait till you're well and just say, like, Dad's well again, and to reassure them, or whether you were able to talk them through what had happened and tell them.
Well, that's what it was. It was only about 2 months ago. There was a Macmillan advert on TV where the gentleman sitting around a table, and he said the hardest part was telling his kids about cancer. And then my boys asked what cancer is, and that's when I told them. I know it's only a year, but a year in them growing up was a big difference.
And how old were they then?
They were, at the time, they were 7 and 4. Now, like I said, they're 8 and nearly 6.
Yes.
And I found they were in a position where I could tell them I had cancer and tell them that's what it was. So I told them about the cell division. I don't think they quite grasped it, but they understood that it's an illness that's hard to overcome.
What was their reaction when you told them?
To be honest, I don't think it quite sunk in how serious it was, which is a good thing, really. I think they saw it as mainly as me having a poorly leg.
Yeah.
And they said my leg's fixed now, and that's all they were bothered about, really. I think they bothered that they had the dad back.
Yeah.
I don't think they really understood the whole cancer issue.
Yeah. If they see you well and back in your normal role, that's the key thing for them.
That's the key thing for them, and the key thing for me, really. Like I say, it was to be a parent again.
Yeah.
The whole time away in hospital, that was the hardest time of my life. I've never had anything as hard as that to go through.
Yeah.
When you've got 2 young children, and you're missing everything. I was in from hospital from the Monday to the Thursday, 3 weeks out of the month. It's such a big chunk out of your life and out of theirs. When they come into the hospital, of course, I was too poorly a lot of the time to even see them.
You had your partner around at the same time.
Yeah.
Sometimes it's quite a burden on them when they're seeing their loved one unwell, but they're also having to do more at home because you're not around.
Yeah, Gemma was an absolute rock. She did everything. I mean, she carried on working. Obviously, we had to have family and friends help us out a lot with the looking after the children. But yeah, she was an absolute rock. She used to come and visit me most days, most mornings in hospital, and bring me food when, obviously, the hospital food I didn't really enjoy. But she was always there for the boys as well. But the house was always, she even decorated the house as well when I was, she was amazing. Yeah, she was amazing. Yeah.
How's she getting on now?
A lot better. I think she didn't really show what she was going through, I don't think, when I was ill. But now we're 100% better now. A good couple of holidays away, we're all back. I think we're getting back to normal now. But yeah, she's come out the other side as well as me.
That's good. That's good. Let me ask you a little bit more about the surgery, because people may be facing that themselves, and yours is maybe a less common type of tumour. So what did this surgery involve? You talk about from when you knew you were going to have the surgery. What did they tell you, and what then evolved regarding the surgery?
Okay, the first time I was notified, my trial nurse gave me a leaflet on osteosarcoma, about what to expect, the treatment, and of course the operation. When I read about the operation, I was pretty much terrified. The booklet just suggested that I'll lose the bone. It'll be replaced with a prosthesis, metal prosthesis, and most of the time a new knee. And of course it also described that I would lose lack of mobility, can't do contact sports, won't be able to run, and that really scared me, the thought that I couldn't be as mobile, especially with my children. So even going down the park, it would be a real challenge. The actual surgery itself, leading up to the surgery, it didn't really sink in that well until the actual day before, when I went to Birmingham and I stayed overnight in the hospital. The next morning when I woke up and they were taking me down to theatre, that's when it really sunk in of what was going to happen, and about losing obviously all the bone and having this replacement being off my feet, and that was a big thing to overcome. It was quite terrifying. Do
you feel you had enough information about what was going to happen?
No, I didn't at the beginning, because at the very beginning my specific case, my oncologist said it would just be a replacement in my shin. It wasn't till a month before or a few weeks before my operation they said that I'd be having a new knee, and it'd be going into my top half of my leg as well. And that's when I got quite scared then, because it was going to be much bigger operation than what I thought it was going to be.
Did you get to talk to anyone who'd had the operation, any past patient?
No, unfortunately not.
Would you have wanted to at that
time? Definitely. I think I've spoke to people during physiotherapy that have had the same operation, and they said the same thing, having no one there to not understand what you're going through, the physical challenges as well as the mental challenges of having to learn to walk again, especially with an illness. You're having to try and fight that as well. That was the hardest bit. I'd love to have had someone or a lot more information regarding the limitations of what I was going to face.
So now let me say to you, there might be somebody watching this who also maybe doesn't have the contact locally, but they see your account. What would you like to say to that person, given you've been through it? What advice or tips could you give them from your experience?
The main part of the advice is you need to take it day by day. Don't get overwhelmed by the whole situation. It's so easy to just get flooded with all these emotions of being able to walk again, as well as the cancer. So the main bit, you need to take it step by step. Have someone that's there with you all the time as well to help you out. I always found it so much easier if Gemma or my mum was there to help me out, just step by step. Physiotherapy, step by step, day by day, it does make a difference every day you go. You might not see it, but at the end of a month you look back and you think, wow, it's how much more you can do from what you could earlier that month. It's fantastic.
Yeah, that's actually useful to compare yourself to, let's say, a week or a month ago.
Yeah.
Not necessarily, yesterday, because that can be up and down, can't it?
Definitely.
From day to day.
I did, and I still do, struggle with depression due to the illness, and because of that, if you just keep looking, yesterday, if a lot of the time you just think, yesterday I could bend it so much and now I can't bend it that much, and if you keep going down that mentality, you won't get anywhere. I mean, there was periods of weeks then that I'd give up on physio because I think it wasn't working. So it's important. I mean, it's easier to say now after the situation, but it's important just to keep going day by day, concentrate on your physio. You will have bad days.
Yeah. And people often ask how much should they push themselves during that physio or rehabilitation period. You know, when they're worried they might do some damage, or they're worried they might have a fall or something might happen. There's a balance between not doing enough. You could just kind of stay in bed and hope that someday kind of everything's going to be fine, or doing too much. Is there anything you could say in that regard?
I went through it all. There were some days where I did found it too hard to even get out of bed, and I stayed in bed for 2 days in a row. But then other days you get too motivated and you just push yourself so hard that actually the next day you can't do your physio because it hurts so much. And I did have a few bad falls as well, overworking yourself, especially if you're still going through chemotherapy like I was. The physio takes a big toll out on your body, so you need to do little bits at a time. You just need to keep just doing little bits every day and don't overexert yourself. But if some days you do find it too hard, just even if you do have to stay in bed that day and you can't face getting out, just still try and at least work the muscles a bit if you have to stay in bed. So that's the best bit of advice, to say don't let it seize up.
Who was involved in your care that you found valuable for you?
I had my specialist Macmillan nurse, Anita, and she was Macmillan. All in general were fantastic. They were amazing through my whole trial. It was amazing. I also had my own psycho-oncologist and my 2 trial nurses during my chemotherapy, and then obviously my main oncologist as well. So it was I had a really good team, especially even just the chemo nurses. They're all fantastic. Anything that you needed, they'd all bend over backwards. Even if you wanted a plate of chips, they'd go out the way. And
And I don't think everybody gets that treatment, but you did. So let's come on to that phase, which is the chemotherapy. Again, you were in a trial, so you perhaps had the latest thing in a way for chemotherapy. But it's not always easy to decide on a trial, because it's not that or nothing. It's a new drug or an existing drug which is meant to work as well as we know it can now. So how did you make the decision on the trial, and also how did the chemotherapy go subsequent to that?
There was the first half of my, looking back to when I had the chance, it all came down to numbers. I got given the chance of being on a trial, and the drug at the last half of my chemotherapy, which was the trial, would give me an extra 10% chance of survival over 5 years. Just that 10%, I had to take it. Even if I didn't get it onto the trial, I had to at least try and get onto the trial.
So they were discussing those, outcome statistics or prognosis in quite black and white terms with you. And were you somebody who appreciated that? Did you want that information?
I needed to know. I find that I do need to know the chances, and it did terrify me, because with bone cancer the survival rate it's so. It is scary. So that extra 10%, I had to grasp at it. So you wanted the best treatment that was available, and that was available to you. You started the chemotherapy, and how often did you have to have it? I had to have chemotherapy. I went in on a Monday, stayed in for 4 days till a Thursday night. That was 3 weeks back to back. Then I had 1 week off. Then I went in for the next course, which was another 3 weeks.
And how many altogether? 2 or more?
Oh no, I had 3 months worth.
3 months altogether
before my operation.
So roughly 12 cycles or so.
12 cycles, and then double after. I had double the amount after my operation.
The same again, but double.
Double the length.
Double the duration. So that's a lot of chemotherapy.
And the last half, that was when the trial kicked in. So I had an extra drug thrown in. So it sounds like
altogether maybe 36 cycles or weeks of treatment
it's a lot.
Over a long period of time, plus the combination of drugs. So you of all people would be in a good place to answer the question about how difficult was it to tolerate those drugs over that period of time. Also all the attendance in hospital, and the effect on your body as a whole, how long to recover. There's a lot of questions in there, but what was your overall feeling about that?
when I first knew about the duration, that terrified me, obviously. The actual drugs themselves, the first 3 weeks, it was just sickness, but I got over it quite quickly. It was just a bit of a bad tummy.
Did you have any anti-sickness medication?
I had a lot of anti-sickness tablets, but you're on that many tablets, not just while you're in hospital, but when you come out, there's steroids and a lot of tablets. The actual chemotherapy drugs, they made me very poorly. I was extremely ill. I did go down to about 7 stone.
That sounds very low for you, because you're quite tall.
I'm quite tall. But
what's your normal weight?
Thin. I'm 11.5 stone.
Yeah, well that shows you how much it did affect your body.
Yeah.
And a lot of that is, muscle mass as well, isn't it?
Yeah, definitely.
Things you actually need to build up again afterwards.
Yeah, definitely. I was just so weak, but I was so ill during the chemotherapy that you can't build up any muscle. You can't do anything to help yourself besides drink the milkshakes. But I had a lot of side effects. I had so many ulcers in my mouth. My throat all closed up, so eating was...
You had mouth ulcers and throat ulcers. They can be really bad.
They were terrible. I couldn't even swallow for 3 weeks at a time. For 3 weeks, I had to have just literally I had to be fed via a tube for 3 weeks, and as well as anemia. So I had to have blood transfusions.
You'd have to be quite determined as a person to get through all this. I mean, is that...
Just my children.
Yeah.
Just the thought of...
Because, a lot of people, roughly 50%, don't complete the course that's prescribed, and you can understand why when you hear...
I didn't complete the very last treatment. I was too ill. I even got advised almost by my oncologist to not take the last course, because the extra drug that they threw in, I had all the side effects. I had raging temperatures that went up over 40 degrees. And of course, with my anemia alongside that, my weight, it was just unsafe for me to carry on.
I understand. But yet you'd completed most of it by that stage.
Yeah, and it was just literally the last, it was about a week's worth of chemotherapy.
So what was it like when you finished that final session and then you were allowed not to come back to the chemotherapy suite?
It didn't actually feel like I'd finished the course, because I was so used to going back into hospital after chemotherapy for infections. There was so much more times I wasn't at home as well due to infections and things. It's not just the time when you're in for chemotherapy, you're in for so much more. I had Hickman lines put in, so I had to go in on my days off for Hickman line cleaning, blood tests. So when they said my chemotherapy's over, it still didn't sink in that I wasn't coming back.
I see. You had a lot on your plate still, and you still had to attend.
You still feel like you have to come back.
You still had to keep attending.
Yeah, Hickman lines removed and things.
Was there a point later where you kind of felt, now it's over? Or did it just gradually diminish with time?
It's just gradually diminished. Because obviously, because of... you have to keep going back for all of the scans. It becomes more of a distant... It's distancing yourself. It's not it's over feeling. Yes. It just becomes more subdued. It's still always there with you. Because it's such a big part of your life for that year that I never kind of got the feeling that it's all over, especially as I keep going back for checkups still.
Does that still provoke anxiety or negative reaction when you've got a checkup coming up? Yeah,
I still get very nervous during that time, but it's a bit strange, but I find it quite relieving still that I'm still going and being checked up. Because obviously when you're not being checked up, I'm still very anxious about the cancer returning. So I find it when obviously you get told your results and they're a positive result, obviously I feel much more enlightened after that time. So it's actually nice to keep going back to the hospital, in my experience, just to be checked up and say everything's okay.
You wouldn't feel totally confident yet to just kind of be left for a long period without receiving another check to make sure things are okay?
No, I wouldn't feel confident enough for that still now.
Because that actually is an issue for a lot of people. When we say to them, you're well enough to not be monitored very frequently, maybe even once every year or so, that means that person's basically on their own for a long period of time. and that can provoke quite a lot of anxiety in itself. And we're not very good right now at providing the support in that period. We should be. I'm just saying we're not good. We need to develop and work on that.
Yeah. So yeah, I would definitely be very anxious about being left on my own at the moment. I think when you're with a group of people that are so close to working with you and such a network around you that's kept you in such good health for a year, when that goes, it's like your security net going.
Definitely. Let's take a little break there, have another drink if you want it, and let's have a think together about some other areas. I mean, I'm going to ask you about how things are going now a bit more, and we could talk about anxiety or depression if you want. It's up to you whether you want to put that on there.
I think, well, it'd be quite important to. It's a big part of the. It's a big part for me still. That's the bit that I'm still.
And also, what are you still struggling with, and also what do you see in the future for yourself?
What do you find helps you the most, sort of thing. And obviously, the pressure you must have put on your partner through no fault of your own can make your partner be, in some cases, as equally depressed as the person going through it. It depends on their character.
Yeah, the thing with Gemma, she wouldn't tell you if she was feeling down. She's one of them. Strong. She's like a rock. She's sometimes. I mean, I did catch her one day crying.
But she keeps
which was a big shock for me. I've never seen it.
She doesn't show it.
She doesn't ever show it. She's just one of them. She's a night worker as well. She works nights still now. She just do it in healthcare. She's a nurse. Yeah. In an old people's home. She's
seen a lot herself.
She's seen a lot herself. Bless her.
Yeah.
Okay. So should we start? We talk about anxiety and depression a little bit. So I'll restart there. Let's talk about some of the emotional complications that come up, because it's one of those areas that affects a lot of people, but not everyone either talks about it or is offered help in that area. But did you suffer a lot of emotional problems, anxiety or depression or something along those lines?
Yeah, I did definitely, especially after my operation. During the time of when you have to be in traction where you can't bend the leg, life felt like a very big chore to get through, obviously, because you're not even thinking about physiotherapy or anything then, but all you're going through is either you're in bed or you're on settee with your leg up, and you're feeling sick. So of course it's very hard if you have to get to the bathroom quick, and half the time I'm in traction. So life got for me very hard, especially as I couldn't even help my children do anything themselves. My little one broke his arm, unfortunately, when I was after my operation, and I couldn't help him do anything. But luckily my partner was there. So yeah, life got very dark.
Was it that sense of losing your role and not having the ability to do those things that were important to you at the time?
Definitely. It was the fact that I lost myself almost. I wasn't Tom anymore. I'm literally just this shell that's having to just be injected with drugs constantly and just feeling ill. I didn't feel like their dad at the time at all. And how I felt like I was just living in the house.
Yeah. How was that affecting you as a person? What were your symptoms of emotional distress?
Well, I got very depressed. I got very low. I didn't want to be around anyone, even the boys. I didn't want to be around just because of the fact that I felt useless. It was very hard, even to do any of my hobbies that I used to like, even like just playing my computer, anything. I just didn't want to do anything anymore.
Yeah, your interest and motivation was affected by the depression.
Definitely. I mean, I do bonsai trees and gardening, and I just didn't want to even read anything, do anything.
Did it affect your view of the future, how things were likely to go?
Yeah, I started to see the dark side and everything about like the 1 in 3 chance of survival, and I thought I wasn't going to make it. It got very low. I did get very low. I used to just spend days in bed.
Did anything help in that situation?
Yeah, I had, luckily, Gemma again. She was almost stone cold to a point, but she was very helpful. She used to just treat me like me. She didn't, like my mother, she used to fuss me and ask me if I wanted everything all the time, and almost crowded me to a sense. She meant the best, bless her, that's what mothers do, but Gemma was very cold, not in a bad way, but she was like, get downstairs, your boys want to see you, and we're going out, we're going here, get in the car, we're going.
Basically, she was filling in, and that motivation you were lacking.
Definitely.
She was giving you a structure where you couldn't do it yourself.
Definitely, and she helped more than she knows, I think. Even when I said, I can't go anywhere because I can't get in the car, she went, come on, we'll get you in the car, we'll fit you in, but you come in with us as the family. And that was very important. She didn't want me to miss out, and she didn't want the boys to miss out on time with me. Whereas if it was left to me at that time, I'd have just stayed at home and let them all go out.
I'm sure her role was really key there. Yeah. What do you think of the role of healthcare professionals in that situation?
They were fantastic. My psychiatrist that I still see now, they were amazing. She used to come and visit me at home when I felt really low. There was days that my mum did have to ring her because she was worried. She'd come out and see me, talk me through things, just reassure me. But even my Macmillan nurse, she was always just even a text message or a phone call away. And even my trial nurses and the chemo nurses, I could even ring the chemo suite and say I'm feeling like this, and they'd say, would you like to talk to someone?
So you had that offer.
Always, definitely. There was always a support group there to help me. I just had to reach out and ask for it.
But that can be an issue, can't it?
That was the hard bit. A lot of the time I didn't want to speak to anyone, or I felt that I was okay. I thought that was fine and I was doing everything the way I should be doing it. But I wasn't really. I was just hiding away from it all.
Did you did you miss out at all by not asking for help, or did you feel there was always somebody would come to you kind of aid if you needed it?
I feel like I should have asked for help earlier. I should have asked for help much sooner. I think I was being a bit big-headed and feeling that I can't have depression. I'm much stronger than that. You don't realise how much of a depressant the chemotherapy drugs are on you, though. It's not all down to you, and also the lack of mobility, it's going to affect you. So the best thing I did was ask for help. And of course, when my therapist said you might have depression, would you like to go on antidepressants? It was a real big jump to take them, because I've been very against them. But after they kicked in, it's a gradual thing, but you start to feel more like you again. So they were a big help as well, a fantastic help really.
I guess that's important for people to hear as well, that it's quite understandable to be reluctant to take another medication after all you've been through, but they did actually help in your case.
Definitely.
So that's worth hearing. Did they cause you any problems, any side effects?
Luckily, that's the one drug that I haven't had any side effects with at all. One of the drugs that I was on, one of the earliest drugs that I was on, it stopped working, so I slipped back down into a depressive state, which that's the time I spoke to you, and we changed my medication. And again, I'm fine again now. Of course, I'm still on the medication, but it helps so much.
Now, I would say, straight away that medication can help, but there's lots of other options as well.
Yeah. And
medication's not for everyone, and certain people obviously don't want to take medication, which is fine. So the other options are generally those personal supports, one-to-one talking therapy, and also a rehabilitation approach, going out doing more, and also some self-help materials that are coming online now that perhaps weren't available a few years ago. Also other resources and source of information provided by other organisations like Macmillan or others.
Yeah.
Did you find any of those other additional things?
I tried to do as much as I could before I decided to take antidepressants, because like I said, for me it was a big jump to take them. So I did try spending more family time. I just found I didn't feel connected still. I still felt very distant and very low.
Yeah.
And nothing was quite getting me back to being me again.
You needed a little bit extra something.
I needed a bit extra something.
Sometimes we think of antidepressants as a facilitatory step, something that helps you being able to participate in all those other things.
Yeah.
Not necessarily just the answer in themselves, but just a helpful aid to doing other things as well. Okay, that's useful. And did you have any anxiety symptoms as well? We talked a lot about depression. Anxiety is feeling tense, wound up, agitated, or like something bad's going to happen and not able to feel comfortable and relaxed and like your normal self.
I think I felt like that ever since I got diagnosed. I don't think I didn't feel anxious during the whole treatment.
For you, was it about the illness, the future, or your situation?
Yeah, what terrified me the most, that was the future, or the fact that I might not have one. During last Christmas of 2012, that's when I got quite low, because I thought it was going to be my last Christmas. I didn't think I was going to get better, and that was at one of my lowest points. I was coming to right at the end of my chemotherapy treatment, so I was at my physical worst. I was at my lowest weight. I was very anemic. Couldn't eat solids at the point. I was living on milkshakes. So, yeah, it was very hard.
So I hear a lot there from what you've already said about how much you've been through, and there's never a guarantee, is there, about this would never come back or it's all clear. It's very difficult, these days for people to tell you in black and white terms everything's fine. There's often a lot of uncertainty about what's going to happen in the future, but I get the feeling that you've come a long way and you feel generally quite a way back to your normal self, but not 100% yet.
No, I don't know. I don't think it's a bad thing that I probably will never be the person that I was before. Before my illness, I was very work orientated. I used to work a lot of hours away from home. Now it's put me in a frame of mind where family comes first, and you have to just seek the positives in life. If you are having a bad day, I still take it day by day, because there is a chance obviously it'll come back. So you need to make the best of everything that life throws at you, basically.
So in a way, that different you is somewhat, you've come through that adversity, but there's some positives as well. I mean, in a way, you've reprioritised life. What's important to you?
Yeah, definitely. The family come first. The holidays, I've put much more effort into when we've been away as a family. It's so much better being such a more close unit than we were before. When you're just working and you're just going day by day, I was almost just wasting life. You don't. Life's so precious now. I have to you just day by day take it for what it is.
Sometimes I say to people that it's like most of us go along like almost on autopilot.
Definitely.
You don't really appreciate it. You just go from one issue to the next, but not really spending too much time appreciating what you do have. And sometimes it takes a big threat to us, a big challenge, like a big illness like yours, to make us appreciate what we really do have.
Yeah.
And it sounds like you've done that.
Yeah, definitely.
So what does the future hold for you, do you think?
Well, now I'm trying to concentrate not so much on my career, but I want to try and get a lot more travelling done. There's things that when I was a child that you always want to accomplish, travelling, even Disneyland, things like that I'm going to actually make happen. Just you need to do the things that you really want to do. That's what I've got to try hard to get done. I don't want to look back and think I've wasted what I've been given another chance at. So now the future, I just want to really concentrate on my family. Obviously work's still important, it's still a big thing for me, but I want to try and work on my career as well. I want to be really happy at work. It's important to not just go through day by day 9 to 5 and not enjoy it. If you're not enjoying it, you're going to have to move on and find something. You need to get enjoyment out of your whole day, not just the bits at home. So that's what I need to look forward to.
Is your employer one that can be understanding in that regard? You know, because if you've got a good employer, you can work with them in the workplace and make your job as meaningful as possible.
Yep.
Obviously, if you haven't, there's an issue. You might even need to look for something else. But
definitely,
obviously, that's not easy in this climate. But what's your employer like?
They were fantastic. They really looked after me while I was ill. Being in the print trade, which is what I've been in since I've left school, photography, the second I came back, they really looked after me. It was just go home whenever I feel like I couldn't face the day. But even now, still, my hospital appointments, they're fantastic. They just let me go. They're just a really good employer, which helps so much. You need that flexibility. Without the flexibility, I'd be a bit up the creek without a paddle, really, because you still have a lot of appointments to see.
Has your role changed at work?
Yeah, they've given me a few more responsibilities actually, which makes it a much more meaningful job to go to, having a bit of responsibility in the job rather than just going through 9 to 5. It's nice having a responsibility and feeling proud about the work as well. It's important to us, especially as a growing company, that we make a good impression. So having the responsibility and being a key part in the business is a real bonus. To feel wanted at work as well, it's a real boost, really. Yeah.
Let's think about the big picture of the osteosarcoma as a whole and how that's recognised in the media and elsewhere, and how other patients are getting treatment and access. Is there anything that strikes you about the cancer that you've had and what is going on, you know, in terms of the recognition about it?
Yeah, well, what struck me first, before even being diagnosed, I used to do the worst thing possible and self-diagnose through Google. I used to type in my symptoms and it came up with bone cancer, but it used to say how rare it is. There was only card-hold facts. There wasn't any other kind of media out there. I'd never really even heard of a primary bone cancer. I mean, in the news, it's always breast, lung cancer, and always the big ones. You don't really hear of a primary bone cancer. So I think there needs to be more awareness, especially for young children, as it's more of a young child's disease. There wasn't much out there at all for me. That's why it's important to do videos like this and get awareness out there for the disease, really.
Well, I want to thank you for coming in today. I think your account is really detailed but informative. You know, you talk through a lot of the stages that a lot of people would go through when they're facing this disease, which initially is quite unknown to people. You know, it's one of the less common types, so it's really useful to have this account. And I know that hearing your account overall, I want to wish you all the best for the future, and I know the viewers would too when they hear this. So all the best.
Thank you. Thank you.